Okay, so we're going to do Chapter 50, Diagnostic Imaging. All right, so the things that we'll go through in this chapter, some of the outcomes that we'll talk about are just explaining what an X-ray is and how it's used for both diagnostic and therapeutic purposes. We'll compare the difference between something that is invasive versus something that is non-invasive as far as diagnostic procedures go. We'll kind of talk about some of the roles that a medical assistant might have in X-ray and diagnostic radiology testing. And then we'll talk about some of the common diagnostic procedures. We'll touch a little bit on radiation therapy and the different types that are used. And then there's a little bit towards the end on the risks and safety precautions associated with radiology, and then a little, just a touch on advances in medical imaging to electronic health records. So we look at diagnostic radiology. We have the word diagnostic means that we're using the radiology to help make a diagnosis, to help either rule something in or rule something out. And so there are certain things that we can do that are screening diagnostic radiology, such as a mammogram, where we send somebody on a regular basis to check and see if anything is abnormal. And there's other case scenarios where we'll do diagnostic radiology to actually make a diagnosis. If somebody comes in with a cough and a fever, and we want to check for pneumonia, we'll do a chest x-ray. Somebody comes in and falls down and has intense pain and bruising and swelling in an area, we need to check for a fracture. So we can use it for clinical diagnostic purposes as well. And so when you're looking at some of the roles that a medical assistant might have during testing, obviously safety issues is one of them. Proper handling and storage of films. Now there's a little section, a little PowerPoint that talks about handling of and storage of films. To be honest with you, with digital radiology now, we don't really deal with films. There may be some older facilities that still have some, but on the whole, you won't be doing much of that. The biggest thing is to know the diagnostic procedures that are pertinent to the practice that you're in and being able to provide preparation instructions, pre-procedure instructions to a patient, and then post-procedure instructions, or just what to expect after that particular event or test is over, and then be able to help patients through that, do the scheduling for it. Okay, so we look a little bit at the history of the X-ray. The X-ray was actually developed by a German mechanic, I believe. His name was Wilhelm Röntgen. And Röntgen is still actually considered the unit of ionizing radiation. You'll actually see that near the radiology labs when you go into a hospital setting. The Röntgen, or the X-ray, is a electromagnetic wave or radiation wave that has a high energy level with a very short wavelength. Okay. Once again, we talked how it can be used for both diagnostic and therapeutic purposes. And there's two different kinds of professions that deal with X-rays. The radiologic technologists, or rad tech, profession is the one that actually does the positioning and the taking of the X-rays or the imaging, to where the radiologist is the actual physician that interprets the films as well as performs the invasive procedures. And we'll talk about some of the invasive procedures versus the non-invasive, where the rad tech or the technologist will actually take those films. Okay, and so one of the important things for diagnostic radiology is using some form of contrast medium. And so what the contrast medium does is it makes internal organs denser. And when they're denser, it causes them to illuminate or become a whitish color rather than transparent. And so it gives us a clearer image of what's going on. And you can see here in the picture that we've got the large intestine, and by using a form of contrast medium, it allows us a better visualization of the large intestine. And so when we use these mediums, there's a number of different types of compounds that we can use. We can use heavy metal salts. Common one is barium sulfate. and we'll talk a little bit about a barium swallow and a barium enema. Paramagnetic compounds can be used depending on the situation if we're doing radionucleotides. Iodine compounds are also used, and so one of the important questions to ask someone, we've talked about asking about last menstrual period, but what goes along with this as well is allergies. And so you always want to ask the patient if they're allergic to iodine or seafood. A lot of people there's a little traces of iodine in seafood, and so you always want to ask if you're allergic to either one of those things, shellfish or seafood or iodine compounds. And so if they're allergic to that, then a lot of times they aren't going to be able to tolerate having contrast medium, because a lot of the contrast medium have iodine in it. They can also use gases like a CO2 based gas, so that can also be something that helps to help provide an image, and we'll talk a little bit about that with the barium enema. So the difference between invasive versus non-invasive is something that's invasive is when we actually have a device that's inserted into a blood vessel or an organ. These are procedures that must be overseen by a radiologist. The procedure will require a surgical aseptic technique, and the patients have to be closely monitored. Their vital signs must be monitored because they can start to have issues with that. Okay. Then something that's non-invasive are basically just viewing internal structures, but we're not inserting a needle into a vein or a vessel or an organ. And so the more conventional x-rays for fractures, chest x-rays, mammograms, ultrasounds all fall into this category. Okay, so a little quick quiz. X-rays are blank waves that travel at the speed of light and penetrate solid objects. So X-rays are electromagnetic waves. They have high energy, short waves. They travel at the speed of light. It can penetrate solid objects. What's the difference in non-invasive versus invasive? So remember, non-invasive procedures don't require inserting any kind of device into the skin. So those kinds of procedures would be a chest x-ray, ultrasound, even an MRI is not invasive. Then we have invasive that actually need and require a surgical aseptic technique because we are inserting a catheter or wire of some sort of device into an organ or blood vessel. That would be anything like an angiogram, a number of different things that we'll actually talk about that have to have that aseptic technique. So we kind of touched on this, but some of the things that a medical assistant might do would be it's going to be determined on the state that you're practicing in because they're all a little bit different. Pre and post care procedure are always important, and once again, you'll know what procedures your clinic and your physicians do. So being, just being well versed on that is important. If you work for an ortho office, they may do x-rays and you may have, you might have a little bit more of an opportunity to be involved with this, to where if you're working for a dermatologist, you probably won't. So that's why just depending on what specialty you're in will decide how much exposure you have to this. Patient education is definitely an issue, being able to give them all the information as to why they're having it, what to expect, and then any of those pre and post care procedures will be important. Appointment scheduling, prep instructions, explaining the procedure. You're also going to want to make sure that you get a specific medication history. And another very important question is the possibility of pregnancy. And so a way you could ask that is there any possibility that you could be pregnant? And then asking for the last menstrual period, both of those questions. Now, if somebody has a long-term birth control method like an Implanon or a Mirena, they might not have regular periods. And so that you would want to mark that down on their chart. They might still require, if they haven't had a period within the last month, they will oftentimes automatically do a pregnancy test just to be on the safe side, because we want to make sure that we don't do some of these procedures with someone that's pregnant. Okay, the other thing too is verifying insurance prior to the test. Some things will require prior authorization or referral. Most basic x-rays and ultrasounds don't, but if you start getting to CAT scans and MRIs and PET scans and all of the more advanced testing modalities, those can cost more. And so oftentimes you'll have to get some sort of prior auth or referral will have to be sent off, and they'll have to authorize that particular testing modality. And so a lot of times medical assistants are involved with this because it's front office work. So you definitely may find yourself dealing with that aspect. Okay, so how can you find out what your role is to take as far as radiology testing as a medical assistant? Just make sure you know what state you're in and make sure you check your scope of practice. Okay, so we'll kind of go through some of the common tests. When we look at some of these tests, not all of them will require a contrast medium, but many of them that have some sort of X-ray base to them will require some sort of media in order to help make the picture clearer or to make things illuminated more. So when we deliver contrast media, we can deliver it sometimes more than one route. It can be administered orally, it could be administered by IV, or it could be swallowed orally, or it could be by an enema. And sometimes they'll use more than one, okay? And so once again, asking about iodine or shellfish or seafood allergies is important because of the iodine component. If someone is allergic to iodine, they generally cannot have these mediums. Adverse effects can sometimes be mild or local, but they can also be systemic, and then we can actually get an anaphylactic reaction, and so it's very important to ask those questions. Okay, and monitoring the patients for allergy during the procedure is extremely important. Now, one of the common testing, diagnostic radiologic testing, is something called fluoroscopy. And fluoro means luminescent or to light up. And so they generally will have some sort of chemical that is injected that actually emits sort of a glowing kind of a light, and it actually allows for movement of an organ with that contrast medium. Most of the times when you think about CAT scan and MRI, they tell you to be extremely still and not to move. The cool thing about fluoroscopy is you can actually move. You can see the joint in movement, and so that's actually pretty cool. Okay, and so we'll go through a couple of types of procedures that involve fluoroscopy. The histosalpingiography is one of those. It's an examination of the uterus and the fallopian tubes. Hystero means uterus. Salpingo refers to the fallopian tubes. And so you can see here, right here where we have there's been the injection up through a catheter in through the cervix, and so you can see it lights up the uterus, and then these little thin areas here are the fallopian tubes, and then the ovaries are the small areas at the end. You can see how narrow this is. This is a common procedure, or a common step procedure-wise, if someone is having an infertility workup. If someone has had an infection or something that has caused some scar tissue here, what will happen is the dye would stop, and then you wouldn't see anything else all the way up to the ovary. And so that would indicate that there's enough scar tissue that it's closed off that tube, and that's probably why that individual can't get pregnant. So histosalpingiography can be used during infertility workups. There's also a type of birth control method called an Essure. And an Essure is a little coil that is actually inserted. It's a clinical procedure that's done in a clinic and not in a hospital. And it's sort of the cheaper alternative to having a tubal ligation. And so they'll do a histosalpingiography 3 months after those coils are placed to make sure that the area is patently and closed off and that no dye is getting through. So we do use the histosalpingiography fairly commonly in the obstetric practice. But it can, once again, it elucidates the shape and structure of not only the uterus, but also the patency of those fallopian tubes. All right, so the next one we have here is called an angiography. And so angio means vessel. And so this is an invasive procedure with a contrast medium. You can see here, this is the carotid artery. You can see how the dye has gone up through the carotid up into the cerebrum. And so this can assess arteries, sometimes veins too. In this case, it looks like it's a carotid artery. But it can do a venous check as well. Basically looking for somebody that may have had a stroke or an aneurysm in the brain. An arthrography is also a fluoroscopic procedure where you have contrast medium, but once again we get an image during movement, and so that's why these fluoroscopies are kind of cool and unique. They can diagnose abnormalities or injuries of cartilage, tendons, or ligaments, but it can do it with movement. And so that's the cool thing about these fluoroscopic procedures. Now, honestly, we'll talk briefly about an MRI. And so since the invention of the MRI, a lot of these fluoroscopic procedures don't need to be done or aren't done as frequently because the MRI has no contrast medium, or you don't have to do it with contrast medium. And there's no ionizing radiation, so a lot of these procedures have been kind of put aside, and instead the MRIs are being used because they have such good tissue structure, clarity. But these procedures are here and can be utilized if someone can't have an MRI. So if somebody has a reason why they can't, and they did something to their knee, they could use an arthrography instead of an MRI. Now, a barium enema is a procedure that was actually used to diagnose issues with the sigmoid colon and the entire large intestine. And they use this barium salt. It's a heavy metal salt, and they place an enema with that barium sulfate, and it can be used to diagnose issues with the colon and or rectum, primarily the large colon. If something is a single contrast, it's usually just using the barium as a contrast media. But if you remember back to one of the first slides, we talked about how some form of air could be used with this. And so if we have something called a double contrast, they can use barium and air, and a lot of times it's a type of CO2. And so those are pretty uncomfortable after the fact, but depending on the individual and what they're looking for, sometimes they might need to use a double rather than just a single contrast. Okay. In reality, we don't use the barium enema as often as we used to. There's another procedure that does not involve any ionizing radiation called a colonoscopy, and they don't talk about that in this chapter because it doesn't involve imaging per se. It's actually utilizing a special scope that goes through the rectum up and can check the entire large colon. And so because of that invention, we don't really use the barium enema as much as we used to. The nice thing about the colonoscopy is it can actually do a biopsy, or it can test something right off the bat while you're in there. If you see something suspicious or a polyp, you can take a small sample of it and send it off and know what you're dealing with. The barium enema doesn't have that capability. If you do the barium enema and it elucidates something, then you'd have to go in and take a scope and do the biopsy. So that's why the barium enema isn't used as much, but it does still it is much cheaper, so there are cost differences, so that could be a reason. There may be a few other reasons why a physician might choose to use this, but the colonoscopy has revolutionized exams of the colon and rectum, and so we don't see this utilized as much. Same thing with the barium swallow, where you swallow the contrast medium, and it has that heavy metal salt, the barium sulfate, and it can light up and show disease processes in the esophagus, the stomach, the duodenum, and the small intestine. And remember, the duodenum is the first part of the small intestine. There's another procedure called an endoscopy, and the endoscopy is a scope that goes down the throat and can check and look at all of these same structures. And so we oftentimes don't see the barium swallow used as often, although if there's motility, the possibility of motility issues or problems in the esophagus. Sometimes they will still do a barium swallow, but the endoscopy has the same capability of actually allowing a clinician to do a biopsy at that time, and so we don't see the barium swallow used as much as we used to either. Then two specific tests that we can utilize for the gallbladder. There's a cholecystography and a cholangiography. So a cholecystography is something that also uses oral contrast medium, and it's primarily used to detect problems with the gallbladder and or the detection of gallstones. If there's a possibility that one of those stones has gotten lodged into the common bile duct, which is the duct that leads out from the gallbladder, we can do a more specific test called a cholangiography. So angio refers to the duct, and chol means refers to the bile. And so if we are specifically looking at the bile duct, then we would utilize this test. Now, in reality, we will talk about the ultrasound in a little bit. The ultrasound is oftentimes used first instead of one of these methods because there is contrast medium involved. And so a lot of times an ultrasound of the right upper quadrant, specifically looking at the gallbladder, can give you what you need, and sometimes it doesn't require going as far as these tests. But if the individual maybe is extremely overweight, or there's a reason why it's not showing very well, or if you can't get the diagnosis or the diagnostic criteria you need, then you can go to one of these two tests if the ultrasound doesn't give you the information that's necessary to make the accurate diagnosis. So the next one that's listed here is the conventional tomography. This is actually a CAT scan, and they'll call it a CT scan or a CAT scan. And this really revolutionized radiography. When I remember back in the late 80s, early 90s, when the CAT scan came out, the one, the X-ray itself was pretty revolutionary to be able to see inside the body, but then the CAT scan gave us a capability of actually putting thin slices together to actually get a 3D view. That's the one limitation, or a limitation with X-rays, is that you're just getting a flat two-dimensional view. This takes small sections and actually gives us a 3D view of things, and so we can actually make much more we can actually see more and make more diagnostic, and come up with more diagnostic information by having the CAT scan. And so it's a camera that rotates completely around and gets cross-sectional views in a 360. The problem with the CAT scan is that it can cost a lot. It is cheaper than an MRI. When it came out, it was the most expensive thing that had come out. The problem with it is that it's a lot of ionizing radiation. You're getting thin slices. You're getting a bunch of small, thin slices of film, but then with each one of those pictures is a dosage of radiation. And so that's why we really don't want to overdo CAT scans, but when you compare the CAT scan to the MRI, it is cheaper. And so a lot of times it's much easier insurance-wise to get a CT scan authorized versus an MRI. But once again, there is a lot of ionizing radiation with it, so that is a drawback. Okay, the next one in our list here is an angiocardiography. So this also uses contrast medium, so it's an invasive procedure, and it allows imaging of the blood flow not only through the heart, but the lungs and all the major vessels. If we want to get more specific to the actual arteries that are the coronary arteries that actually provide blood flow to the heart itself, we could then do a coronary arteriography, and that would be more specific to the coronary arterial system. Then we can kind of jump down and go to the kidneys, and these are two specific tests that we can actually do that check kidney function and or urinary structures. And so an IVP is an intravenous pyelogram. Both of these use contrast medium, But the IVP actually has contrast medium given in an IV, as well as orally drinking some contrast medium. And so it actually allows that medium to move through the kidneys, the ureter, and the bladder, but that contrast medium goes through the kidneys. And so if we have a situation where someone has altered kidney function or decreased kidney function, then we can actually do a different route where we do something called a retrograde pylography. This is also called an RP. And it is similar, it can give you similar information that an IVP can, but instead you put a urethral catheter in, and so you inject the dye through the urethra so that you're going backwards. And so the dye doesn't have to go through the kidneys itself, it goes all the way up to the kidney. So this is an alternative if someone has altered kidney function, if they need to have those structures looked at. Then we have a KUB. A KUB is a really common X-ray. The problem is it's kind of limited in what it can show. It does assess the size and shape and position of the urinary organs, but it's just a simple two-dimensional X-ray of the lower abdomen or of the pelvic structures. If you're looking for kidney stones or even bladder stones or maybe a stricture, there is some usage of this, and a lot of people, it's very inexpensive. It costs $50, $60, $70 compared to some of the other stuff, some of the other diagnostic imaging that's out there. And so it still can be used at times, but a lot of times they'll bypass this and go on to more thorough testing as opposed to using the KUB, but it used to be utilized quite a bit. Then the one test that's listed down here is the magnetic resonance imaging, which is our prototypical MRI. MRIs can be done with contrast, but they usually do a pretty good job even without, especially if you're doing soft tissue structures. Because it measures the water quality and it's utilizing magnetic poles, it really does a good job with soft tissue structure, ligaments and tendons and muscles, what have you. And the nice thing is that there is no ionizing radiation with an MRI, so that is the good thing. Limitations are because it's using magnetic poles. If there is some sort of metal within the body, whether it's a plate or a screw from a prior fracture, if someone is a sheet metal worker where they might have little bits of metal underneath the skin, they can't have MRIs done. And then there are some types of pacemakers that you can't have an MRI with as well. And so those are drawbacks. And so that's when some of the other tests that we've talked about might come into play. The MRIs are also more expensive, so that's an issue, and generally anyone that's going to get an MRI is going to have some sort of prior authorization to get that done. Most ERs will just send for a CAT scan because for the most part it's pretty close, it's cheaper, but there are certain things that are better visualized, soft tissue, knees, shoulders, with an MRI, and so those generally need a prior auth to have that particular imaging done. Then we have the mammography, and so the mammography is our prototypical way that we check for internal breast tissues. These particular mammography radiologists are specifically trained in that particular field. They are trained in radiography, but they get extra special training in order to do mammography. If someone were to have a mass or something that was some sort of possible abnormality that was viewed on a mammogram, then they do have a specific kind of breast biopsy that's better than the older excisional biopsies. It's called a stereotactic breast biopsy, and it is computer guided, and it tends to have a lot less tissue damage, and it's a lot more specific. And so the stereotactic breast biopsies have taken over as the primary way of doing breast biopsies if someone has an abnormal mass or something that is presumptively abnormal. We also have another fluoroscopic procedure called a myelography. This is myelo means bone marrow or spinal cord, and so the myelography used to be used pretty frequently to detect spinal abnormalities. But because of the MRI, once again, we don't do them as often. But once again, if someone has one of the absolute contraindications for having an MRI done, then a myelography is something that can also be performed if necessary. So then we move to kind of another area called nuclear medicine, and this area has really become a very large diagnostic radiologic area of medicine, where we actually use radionucleotides or radionuclides to evaluate internal organs. And there's a number of different kinds of nuclear medicine. We oftentimes use this if you inject radioisotopes into the system. It can actually be utilized to detect if someone has metastatic cancer. You can see little what's called hot spots that pop up if someone has had cancer and it's metastasized beyond that initial area. And so that's actually like a PET scan, which is listed second here when we look at the different types of nuclear medicine. And so we have a few different kinds that are here. We have a SPECT. We have the SPECT imaging, which actually is kind of specific for specifically used for stroke patients. And this particular nuclear medicine uses something called a gamma camera that actually lights the area up after you've injected those radioisotopes. And so the spectrogram actually checks for damage from a stroke. So if somebody's had a CVA or aneurysm or some sort of stroke, that would elucidate an area. A PET scan is positron emission tomography. And there's a number of things that you can actually detect with that. You can detect hotspots from cancer, but some of the cerebral things that you can check for are things like epilepsy, Parkinson's disease, and sometimes they'll even use them for certain mental illnesses. People that have schizophrenia and some other mental illnesses. If you've ever watched any of the crime drama shows on TV, they'll sometimes have experts using a PET scan, and you can see different positron emissions in different patterns for people that have certain mental illnesses. And then the third one listed here is called a MUGA scan, and this is a specific scan that can actually detect issues with the heart's myocardium. So these are just different kinds of nuclear tests that use radioactive nucleotides to elucidate disease processes in specific areas. And ultrasound, now they put ultrasound in this, although ultrasound does not have any ionizing radiation like the MRIs. We actually use high frequency sound waves, and when you bounce sound waves off of structures, it can actually produce a bit of an image from that sound wave bouncing off a solid structure. And so the term ultrasound is synonymous with sonogram. You'll hear both of them used, but they both basically refer to sound or sound waves. So those two terms are synonymous. And the great thing about ultrasound is there are a number of different things, gallstones, kidney stones, certain kinds of masses. Something is solid versus cystic, like in the ovary. And obviously here you can see a fetal sonogram. It's safe and it doesn't have any ionizing radiation. You could have an ultrasound every day of the week and it would not cause any problems. So that is the one nice thing about the ultrasound. No ionizing radiation, very safe. And very inexpensive. That's why a lot of times certain things will go with the ultrasound first, and then if they can't make the diagnosis, they'll move to something else. but it is a very safe and effective way to make a number of different diagnostic procedures as far as certain diagnosing certain conditions. Okay, so here we go with a couple of questions that are true or false. Fluoroscopy is used for many procedures, and as we went through and saw that, that would be true. We saw the myelography, we saw the arthrography, so there was quite a few of them that use fluoroscopy, histosalpingiogram. Some of them aren't used as much as they used to, but there are definitely many procedures that use fluoroscopy. Histosalpingiography is used to evaluate the patency of the colon. Okay, well that's not true because hystero means uterus. Salpingo refers to the fallopian tube, so that would be false because we're looking at gynecologic structures with this. Cholangiography is used to detect abnormalities of the gallbladder. That's false. Okay, remember that is more specific for the bile duct, but you could use the gallbladder or the cholecystogram. One of those two would be to be more specific to the gallbladder. For an IVP, the radiologist injects the contrast medium through a catheter. Okay, so now remember the two that we talked about for the kidney was the IVP and the RP, which was the retrograde pyelogram. Okay, and so that's what this one would be, because the IVP utilizes contrast media via an IV as well as orally. Retrograde would put a catheter through the urethra and inject the dye that way. An MRI uses a combination of non-ionizing radiation and a strong magnetic field. That is true. And myelography is done frequently to evaluate for spinal abnormalities. Well, part of that is true. Myelography does evaluate spinal abnormalities. However, because of the MRI, we don't see as many myelographies being done. Okay, so that was partly true, but it's not done frequently anymore. Okay, so we kind of talked about the diagnostic uses of radiation. Let's look very briefly. This isn't too extensive. It's very brief as far as the therapeutic uses of radiation. Okay, and so radiation is one of our frequently used modalities to treat cancer, and it works by preventing that abnormal cellular reproduction of those cancer cells. It's oftentimes used in combination with chemo. You'll hear, I had chemo, or I had radiation, or I had both. Okay, and so we sometimes have to come at the cancer with multiple different modalities to try to treat it effectively. So we're looking at the therapeutic uses. There are two common ones that are used as far as radiation therapy goes. The more common one, we have telotherapy and brachytherapy. And telotherapy is actually the more commonly used method. It's an external beam of radiotherapy, and it can be done in an outpatient setting. It allows for deep penetration of tissues or deep tumors. The word here, stereotactic radiosurgery, basically indicates that you have a very precise delivery of that radiation. Now, precise as it can be. The problems that can come from radiation are sometimes if it isn't precise enough, it can damage outside healthy tissue, as well as causing sometimes radiation burns like a sunburn. So there are side effects that can come from radiation therapy. Sometimes it can actually shut down surrounding organs. Commonly, if someone has thyroid cancer and they have to go through radiation of the tumor or of the cancer of that gland, generally the combo of radiation and or chemo, if necessary, will actually shut that entire gland down, and that person winds up having to take supplemental thyroid hormone for the rest of their life. So that can be a side effect from radiation. The other type of radiation therapy is called brachytherapy, and this is where you actually use radioactive implants and you place it close to that cancerous tissue There are special precautions for this, and they don't use this very often, but it does try to spare the healthy tissue while it's delivering that radiation to the cancerous tissue. All right. So we thought the two types of radiation therapy are telo and brachytherapy. Telotherapy allows for deeper penetration for deep tumors. It's used more frequently. Brachytherapy involves using the implantation of radioactive implants. There's a little bit in here. So we're looking at the safety profile and what we have to do to stay safe around ionizing radiation. There is an exposure badge called a dosimeter, and all radiologists and radiation technologists or radiologic technologists have to wear them. Generally, when they take the x-rays, they're going to be behind a wall and a closed door with a clear window so that they can keep an eye on the patient. But that wall in combination with 6 feet of distance helps to prevent the waves from actually getting to the technologist. Apron or lead aprons or lead shields can be used as well to protect the internal organs, more specifically the ovaries and the testes, because ionizing radiation can cause genetic defects, and so it can actually cause problems with the eggs and sperm. And so it's important to make sure that we use lead aprons or lead shields on the patients to protect their reproductive organs. There's a little thing in here talking about storing and filing x-rays. I doubt that any of you are even going to see x-rays because we just don't see them that often anymore. Okay, and so the last slide that we'll talk about real quick is just electronic medicine and what that's done. I mean, this little blurb here talks about telemedicine, which is really significant now with COVID, and we are getting a lot more telemedicine appointments where things that don't require a physical exam, like talking to the patient, reviewing results, reviewing labs, doing quick follow-ups on things like that can actually be done via Zoom or via FaceTime or Skype, any one of those things. But the telemedicine can also extend to reviewing medical images between doctors. If an EMT or a paramedic's in the field and somebody develops a really strange or odd heart rhythm, they can run it straight to a cardiologist so that they can evaluate it and say, hey, this is what you need to do. So that's been going on for quite a while and has actually allowed a lot of conferencing and a lot of ways for multiple people to review things without having to send it. You can actually, deal with it in prime time, and that's been a wonderful new thing that we've been able to do since the development of our electronic health records, which is the last thing here. So instead of seeing those normal film images, almost everything radiologic-wise is digital. And so digital captures those images. It can you can send people images on their phone of their fractures. And so a lot of the advantages that come from digital imaging are the quality is better, the results are much faster, and there's actually decreased radiation exposure. So that digital imaging that we've come up with has offered a lot of advantages over the storage of having to deal with old x-ray films. And so that's been a wonderful transition in medicine going to digital. So, okay, so I think we're going to conclude this chapter, and then I will see you in the next chapter.